Okay, welcome everybody to Koviki Talk. This is episode 18. Koviki Talk is a multi-episode podcast series where we talk to Pacific Islanders about COVID-19, all things COVID-19. So how to practice faith correctly, how to be safe at home, how to live in multi-generational homes, how to get the vaccine, all things COVID-19 related from the Pacific Islander perspective. And we do that by having different leaders that are involved with the COVID-19 efforts in the PI community come on and talk to us about things that are going on in their particular expertise. So we've had doctors and scientists and community activists. And today we're going to get to know the team in Southern California. So our first guest is Heidi Kenga. She is the executive director of the award-winning Kudaran Chamorro Foundation, KCF, a tuition-free 501c3 nonprofit organization formed in 1993 based in Long Beach, California, dedicated to the preservation of Chamorro culture through music, dance, language, and leadership from the Mariana Islands and Micronesia. Heidi is the first Pacific Islander to receive the California Arts Council Artist in Residency from 2002 and the 14th Papanangui, tribal council member of the Buma Tau Tau Tano Guahan. And if I mispronounced that, my apologies. She continues her efforts to ensure inclusion of Pacific Islanders as a cultural advisor to countless community projects and initiatives across the continental US and abroad. Heidi serves as a community engagement lead for the Southern California Pacific Islander COVID-19 response team, as well as vice president of the Pacific Islander Health Partnership. Welcome, Heidi.
Carl. Thank you, everybody.
Awesome. Next, we have Mele Faiva Manu Blagojevic, was born on the island of Tonga. She was raised in a Christian family, grew up and went to school in Tonga, Wellington, New Zealand, and Los Angeles, California. She has served the United Methodist Church Connection in various ways. Retired from UMW, president of the California Pacific Conference, retired director, Methodist Hospital of Southern California, and a delegate to the special session of the General Conference in 2019. Currently a director of the General Board of Global Ministries, delegate to the Western Jurisdictional Conference, vice chair, Committee on Nominations of the California Pacific Conference, chair SPRC of her local church. Mele Faiva and her family live in Los Angeles. She is married to Denny Blagojevic, and they have 3 children and 7 grandchildren. She is a real estate broker, owns and operates her real estate brokerage and mortgage lending in Los Angeles. She is passionate about serving her church and her community. During this pandemic, she has been supporting her community with information on healthcare, COVID-19 testing, COVID-19 vaccine, other resources, and distributing food 2 or 3 times a month. She enjoys sharing the love of Christ through the online lay servant ministry classes on every Tuesday evenings and spending time with her family, especially with her grandchildren. Welcome, Mele Faiva.
Thank you.
And also on with us today is Audrey Allo and PA. Audrey is a native Hawaiian Pacific Islander navigator, educator, and advocate for 20 plus years in the Southern California region, addressing health disparity, equity, and civic engagement. She is currently the president of the Pacific Islander Health Partnership, president of the Leangafa Leadership and Education through Nganganafa Samoa, and first vice president and Health and Community Outreach Chair. She is a member of Hawaii's Daughters Guild of California, resources lead for the Southern California Pacific Islander COVID-19 Task Force, and part of a national effort, a board member of the Pacific Islander Ethnic Art Museum, a member of the Community Engagement Research Participation, Lindquist Institute, and patient advocate, the UCLA Clinical and Translational Science Institute. Welcome, Audrey.
Aloha, mahalo.
So we always we do a question, usually kind of an icebreaker. And I really liked the one we did last week with the San Diego team. And what we asked them was, what do you enjoy the most about the area that you live in? So we, in terms of Southern California, it's such a diverse area. I've had Southern California in the region that I work with in my 9 to 5, and seeing people across the country think that like LA or Venice is the same as like Hesperia or, some place way out in the desert. They don't even understand like how vast Southern California is. So I think I want to stick with the same question we used last week for the San Diego team. You got like, I don't know, 6 or 7 professional sports teams down there. There is stuff to do all day long, every day in Southern California. But let's start with Audrey. What do you like the most about living in Southern California?
I like that there are so many of us here and we come from all kinds of different backgrounds for Pacific Islanders. For the longest time, I lived in downtown LA in the mid 80s, and I couldn't find a Pacific Islander. And I was going to school and I talked to a young lady and she says, "Oh, I have somebody that takes hula lessons." So once I found them, I found the entire community because, we don't take out ads. We don't put anything in the yellow pages, none of that stuff. It's all word of mouth. And then I was like, when I found the halau, I was like, oh my goodness, I didn't even realize that there are these many people here. But I do like that there are so many of us here. It's kind of sort of like being home when we are able to get together at festivals. And, the weather for the most part is not bad. I can't complain too much about it. So yeah.
Awesome. Naki, you're on mute.
It's always that you just have to meet one person and then 2 degrees of then you meet everybody else. So, Mele, how about you?
Hi, I like being here because of the weather. You can see my background. It's nice and blue. Unfortunately, some areas are not just quite as nice as my background, but the diverse in our area here is so diverse to where that you can just call your, the next door guy is your brother, especially when it comes to us as Polynesian. For me, the Samoan and the Tongan are brothers and sisters, and as well as the other islanders here. My parents been here for over 40 years, and this is the only place that I know is Southern California. And so as my conference covered from Saipan to Guam to San Diego. And it's just wonderful to be, to call this place home, to be among your own people and feel wonderful to be here. Especially with my church and especially with all my communities, get to know everyone in this area. And I would not go anywhere else but here in the Southern California, in Los Angeles. And I'm only about 5 minutes from the beach and about half an hour to San Fernando Valley, and maybe an hour to San Bernardino, and where it's hot in the summertime, and I just like being here. Thank you.
That's awesome. Thank you, Mele. Heidi, how about you?
Yeah, I'm a military brat. My dad was in the army. My name is Heidi because I was born in Germany, and we moved everywhere. So to settle here after college up in San Francisco, I'm originally from the Bay, to come down here to the South, it's the weather, it's the people, it's the community, and to be able to have the Chamorro dance, our dance group down here, and then even creating one down in San Diego and commuting up and down the coast. Yeah, 5 minutes away from the beach. The weather hardly ever changes. Cold is not even mentioned in our vocabulary down here, but it's the beauty of seeing the beach like back home, seeing that, being able to put your feet in the sand, and our community is plentiful here in Southern Cal. So I'm just, I wouldn't want to live anywhere else but back home, but this is home for now.
Awesome. I think that's one of the misperceptions, and I didn't realize it until I had Southern California in my region. About, I would go to our corporate office in Ohio, and they would talk about, LA as being one, what California is one big long beach, especially Southern California or LA. And once I had the market, I was like, you got snow, you got the beach, obviously, but there's desert, high desert, low desert. And I think that's, just lost. So when I think about the Southern California team, I think about all of the different things that you need to address in reaching our community in education, with COVID-19, just pushing the most current um, information out. And I think about that, and it makes me wonder do how do you do that? How do you get the information out to such a huge area that, this could cover literally states? If you took Southern California and you laid it across back east, it could cover, 4 or 5 different states. So I guess that's the question. Just in general, um, how did the team go about addressing the diversity in both in geography, um, and space, and then just the different groups that exist all over Southern California, because it's such a huge area, and
Yeah,
that's for anybody.
our lead, Cowan Young, it's her decades of, advocacy for our community in Southern California and across, the nation, and back home in the territory. She brought us all in. I mean, there's over, 50 plus of us in this team. We cover countless counties, from San Diego, Los Angeles, Orange, Kern, San Bernardino. We cover all of these counties, and because of her leadership and the need and the love for our community, we easily came together, a year ago. But it's just been it's been a challenge, yeah, because we're so diverse also within each of the communities. But with the passion and the love for our community, like I mentioned, it came together very easily. So that's what I think.
So if I could add a little bit to that, because we've had working relationships with each other over over the decades, it made it easy for us to do the reaching out and pulling people in for COVID-19. And when we did it, we also, because all of us are doing community engagement work, we are also aware that we need to come with one voice and not have multiple different messages to be confusing. And so we really work hard at vetting our information, vetting our sources to be able to push out, the best information that we have at that time. Sometimes no matter what we do, and you've been, talking with Nia before the program, no matter what we do, it doesn't seem like it's enough, or the best laid plans go a little bit askew. For instance, we're trying to get vaccination going this week, and some of the because of Blue Shield coming in and things changing from counties to the state overall, we're trying to navigate that, and things that are already in place are no longer in place. So we're having to wait until they let us know what we can go forward with. And part of the problem with that is that you've already used your trust that people have in you to push out the information. And then when there's the delay, then they're like, look at these, here they go again. And so then we have to like kind of build that trust again to get them back to be able to go, and get the testing and the vaccine. But to answer the original question, Carl, it's just the relationships that we have with each other that we have, nurtured through all of these years, and to be able to talk to each other and say, okay, what do you think is best? How is it best to move forward with your community? And we all have something that's similar, a little bit tweaky, but you know what? We can work with that. If that's the only thing that's different, then we can work with that. Thank you.
Yeah, we created a website, Pacific Islander Health .org, to push out information. We have work groups that we broke out into resource work group, the medical work group. We have community engagement work group where we actually do our own talk story series. And we brought in our, Pacific Islander veteran community, our, the educators, just all of the sub communities, even within our community in Southern Cal, we have brought them in. And our faith-based leaders, they have been a huge asset to pushing out information and ensuring the trust between the information that we are providing. But I just it's been a challenge. But yes, as Auntie Audrey, said, it has been those trusted relationships that we have built over the years, and it's just it's a beautiful process to see. And we've brought in we have a current like wellness program, wellness phone banking program, and we brought in 14 CBOs and faith-based groups, and we have to all reach 250 um, contacts and just provide them with resources, find out how they're doing. We had a training, and it draws in yet another 2,500, 3,500 Pacific Islanders in Southern Cal. So those are the ways that we are doing it.
Do you also find, and we take the information better from people that look like us? Are you finding that people are responding better because you guys are out there now, reaching the community? You've started your Pacific Islander Health. There's the PI COVID-19. Are you finding that your reach is more now that we have these programs out there, and then our faces are out there more often?
I would say yes, and part of it is like, yes, but it's also too, we're touchy-feely people, and to not be able to get out there and be face to face and the hugging and kissing and stuff, it makes that a little bit difficult. I think we're getting a little bit more familiar with the Zoom concept and the Google Messenger thing. So, now that we're getting a little bit more familiar with that, and they get to where they recognize people, and then it's interesting because some of our elders too, they're on they see Instagram or they see Facebook, and so then they're able to look at that, and then because too we're such a flyer driven community, to be able to put those up, and they can probably download it and print it out so they can actually physically look at something. But not only that, it's like we talked about it earlier. It's like, yes, we are Pacific Islanders, but we do not live on an island. And we have all of these other people that we live next to and we have relationships with, and even sharing that information with them. It just makes all of us healthier together at the same time, and, the interaction. So as much as, I tell people all the time, I am Native Hawaiian Pacific Islander first, but my neighbors, I'm going to reach out to them as well.
Yes,
Go ahead.
I agree with Audrey. Getting our faces out there, especially with food distribution, especially with the COVID testing, especially when you help the elderly to go and get their vaccine done. I think what we have missed from last year is the hugging and greeting our people. But because of this COVID, everyone will have to wear their mask and keep their distancing and all that stuff. But at the same time, it's very important to get our faces out there, to have that connection with our people. Even with our Zoom meeting, even when we talk to them on the phone. But I find it very effective is when they get to see you after so many months. It's like, oh, you're out here to help out. Yes, I'm glad we have some food to share. Why not? But yeah, getting to see each other, yes, definitely. And it's another way too to get out the information that we get. And I just want to thank you, the team here, for us getting all the resources that we can tap into. And it's just so huge here for me, especially when I'm out there with the people. It's like, if you don't have this, yes, we can help you. Here's a phone number that you can call. Contact us here whenever you need, and spread it out to our community. And it doesn't matter who it is that needs help. There is help here that we can do for you. Absolutely.
Yeah, I think when we were able to distribute, in all of our areas to San Diego and Riverside, San Bernardino, and LA to actually be able to deliver, PPE to our faith leaders and have those supplies, and even delivering it to like the museum here in Long Beach, the Pacific Island Ethnic Art, Art Museum, and so that when people come there, they have the supplies that they need. Those are the small moments where we get to see each other again, but them knowing that we are there, or when they visit a test site, out in Riverside or at Mele Faiva's churches, like it's been, just even when we do it with each other, like, oh, here's 1,000 masks, let's distribute it, and let's make our bags for, our Pacific Islander test site, at Lennox Church. And so it's things like that where they know that we're here, and then they know that they see us, right? But also like specific campaigns that we did with LA County DPH. They went to each of our communities, Marshallese, Chamorro, Tongan, Samoan, Hawaiian, and took photos. And so we put together, virtual, they did all the work. They did all the virtual, pamphlets, and they even allowed us to translate all the information. So we were able to push that out in social media and our network. So that was a huge step into our other groups, regional groups, being able to do that with their counties, health departments.
So what is the right now with COVID-19 being where we're at, I would say, in the stages of it. So we're, now we're really educating with the vaccination. We're pushing information about test sites and availability and what stage we're in and all those kind of things. Do you want to talk a little bit about how the teams, where the team is, I guess, at this point in terms of what are you pushing in a priority of messaging and those kind of things?
Heidi, you want to go? So we were very fortunate to be able to get biological laboratories. And I can't remember Yose's last name right now, but he works for them and he reached out to us. And so we were able to get test kits that you can take home and do your own swabbing, whether it's nasal or oral. And then you just, you fill out the paperwork, stick that sucker in the tube, snap it off, put it in the bag. He comes back and picks it up. And within like 24 hours, I think we got results, 24 to 48 hours.
Yeah,
and so, yeah, and so we were able to do that. And we had been having such a difficult time, LA County had, in getting testing. Orange County was doing well. Riverside and the IE were doing, they were doing, they were able to get the testing. We were not, and so this really enabled us to help. And then Mele Faiva had it at her church, and we're doing it at other areas too. But right now, I think the biggest thing for us is the vaccine and getting our people to come in. Now that they're finally willing to get the vaccination, there was no vaccination, and then it's so difficult to register and get in there. And so all of those things, and I'm sure everybody else is going through it as well. And we have an opportunity through the LADPH to have 100 slots for Pacific Islanders. So each one of our communities took 20, and we're fulfilling that. And hopefully once we show them that we're able, that we really and truly need that they'll give us more slots. So getting the information out about that too. And so Cowan and I worked with a young lady, Savannah Carson from UCLA, with the Community Engagement Research Participation Group. And she did a focus group talking to members of our community that were 50 and under, and then 50 and over, to see how they felt about the vaccine. Would they take it? What are some of the, the pros and cons? And actually came up with a very, very good FAQ sheet, and then also a PowerPoint. And I really and truly like it because it is simple, everyday language. You do not have to be a medical professional to understand it. And it hits every single thing. It talks about only the 3 vaccines. They're not talking about Johnson & Johnson, only Pfizer, Moderna, and AstraZeneca. But when they talk about it and compare it side by side, it's so very simple. And so I've been sending that out. And then also to even some of the people I work with in academia, when they saw it, they said, Audrey, can we send this out? Absolutely. And so to be able to have simple language information and not, where you have to like read 10 pages to get to that crucial piece, I think is really important.
Yeah, right now, LA County just got funded with community partners and LADPH. So we're actually hiring 5, community health workers with a lead, and it's really it's a community equity fund. It's aiming to alleviate barriers in navigating resources for our communities who have been highly impacted by COVID. So we know that COVID just doesn't affect, one part of our lives. It affects, our entire life. But we hope to build really strong infrastructure for more proactive and meaningful, engagements with LA County, because we're so large in this area. But we hope to bring in, 20 partners, NHPI partners in this grant, along with the actually hiring. We want to really, continue to keep those, folks as community health workers representing our community. So hopefully Antinia will help LA County have their own health community center soon, which we're all hoping for. We've been working towards for some time. I know I've been an advocate for quite some time for that.
I just want to be, I want to say the education for me, to educate our Pacific Islanders, because it has been since last year. People are afraid to take the test. People are afraid now to even take the vaccine. And for me, it's huge to be able to keep offering the services, especially for testing, at least that. And then now we just recently, last month, to get the testing done for our people. When Audrey was saying that we are grateful for this lab, to our famous Joseph Aulai, that he's the one that was actually providing the kits for our people to get the testing, and he gets it out there to the lab, and within 24 hours to 48 hours, they get their result. But in order to get the testing, our people are so afraid to come in and do the testing. But I think the more we provide the testing, I am actually asking Joseph if we can do this once a month out of my parking lot at our church. And he agreed to do that, and I'm so grateful for that. And now the testing is good now that I have people calling me that they're gonna be coming to do the testing. Now, last Wednesday, I want to thank this young, beautiful Samoan girl, Corina Penaya from the API, for providing me with such a short notice to get in so many Pacific Islanders to go and get the COVID, to get the vaccine on Wednesday. And she was able to do that. When I asked her, I said, look, all the people I have are undocumented. Can we help them? My goodness, she was able to help those people to get the vaccine. And I'm just like what I said earlier, I'm just so grateful for this team. When you need something, you are out there to provide for our people. Yes, for me, educate our people.
And I think, Carl, when you mentioned earlier about how this is like such a wide area and we have so many people and there are so many different things that we need. And just like Milifaiva said with, with immigration, it's like trying to get immigration relief. Fortunately enough with the testing, even if you are not a citizen, even if you're undocumented, as long as you have identification so that they can say that they, we have a live body that we took care of over here, and that if, to be able to get the test results back. So, when we're looking at that citizenship, immigration, DACA, trying to get people educated, doing workshops and clinics, it's everything. And even when we talk to government agencies, we can't just address COVID by itself, because it's like so many other things. And I know you guys already know all of this stuff. It's why we got to vote. It's why we got to do 2020 census. It's, everything affects everything else. And unfortunately for them, we don't fit in that box. we don't fit in that box. And I can say that on one part here, we have the Marshallese community. When they started vaccinating 75 and older, they only had a couple of people that were 75 and older because they have been so devastated by death with COVID. And so then they're going 65 and over, and they still have a lot of deaths. So trying to tell people, can we bring the younger ones in that are still, here to get vaccinated? And, they're standing hard and fast and saying no. So we're always trying to talk to talk to government agencies and people, to be able to think outside of the box for us, because we don't fit in that little box. They got to kind of have a little leeway for us, so that we can help take better care of our people. But I am grateful that they're allowing us to have undocumented people that can be tested, that can be vaccinated, because if we can all get vaccinated, we already know the story. We're all going to get better sooner and be more safe sooner. So.
It only seems like that would make sense. Like you would be kind of cutting your nose off to spite your face if you said, well, you're undocumented, so you can't get the vaccine. It wouldn't make sense when we're trying to take care of the entire population that we would say, oh, there's just this bunch of people that we're going to pretend don't exist. They're going to run around without a vaccine, but we're going to pretend that we're going to be safe. Even just from a numbers standpoint, that wouldn't make any sense anyway. So it's great to have advocates for them, and have people like Mele that are saying, like, I've got to get, like, I need, this group of people need services. How do I get it done? And this brings me to, one of the things that I was so proud of the Pacific Islander community was, we all knew that, obviously COVID was a problem. It's a international pandemic. But once the numbers came in, and it was kind of like we suspected it, but we weren't sure. And then once the numbers came in and everybody went, whoa, like this is really impacting our people in our community. The way that our community rallied in groups like the regional task force and the national task force, and people like yourselves, that would, could be a situation where you're looking like it's just overwhelming. Like there's 20 million people down in Southern California. How are we ever going to, address that? But to see everybody just get together and dig in and get data disaggregated, big things that you all are a part of, it just makes me proud to be here talking to you about it. Did you think it was, did anybody think of the scope that was when they were digging in, or was it just something that we said, hey, this work's got to get done, and somehow we're going to get it done? Did you realize the magnitude of it and think 20 million people, how are we going to reach, all across that? Or did we just jump in, roll our sleeves up and help?
Yeah, I don't think we even thought twice. We knew what had to happen. We knew we had to come together, and we knew we had to come together quickly. So, especially because our communities were so strong in family support and faith, and there was no way that we were going to be left behind. So, yeah, getting the data disaggregated is by county in Southern Cal. Done. I mean, LA County alone, we have 3 health departments. We have LA DPH, we have Pasadena, and we have Long Beach. And we are in contact with both of them. We could easily just email the leads over there in their equity groups. We work with them. I meet with Long Beach on a weekly basis for, hard to reach populations in Long Beach. There's 400, 500,000 of us in Long Beach alone. So, and they've offered now vaccine appointments for our community, because they realized, whoa, we went to them and said, make sure your numbers roll up into LA County and they are disaggregated for us, because we need to know. We need to be separated. We need to know exactly where we're at. But yeah, we no one, I don't think anyone hesitated. We know what to do. We knew what to do. We were just going to figure out how to do it. And this team came together really quick with, Lisi, Cowan, and Audrey, Rita, myself, and then everyone just, we kept reaching out. Who else can help? Who else can help in that area? Tana and Sefa out in the IE, and just pulling in all our folks. It was amazing to see. Oh, this week we have two new folks that want to join the team. I mean, we've had folks reach from Alaska wanting to help and get more information on how to do these things. So even LA County in that core group, we were duplicating ourselves and saying, hey, let's go find out LA County. They let us know who the contact is in Riverside County. So let's call them up and let's say, hey, this is what we need. You need to provide us this, you need to count us in, and you need to separate our numbers. And we did it, we did it for all the counties in Southern Cal. So very, very, very thankful and very proud to say that nobody hesitated. No one hesitated to volunteer. Mind you, we are all volunteers. And they stepped in right away. And even support of Epic and the national team, which also, came together really quickly, was amazing.
I just want to jump on Carl's bandwagon with the LA team. Nobody knew we were here, right? And you guys just jumped in and disaggregated the numbers, separated the numbers, and then because the numbers were so high, it took notice. The government, the city, the county took notice that we were here and we were hurting. And so I'm so grateful for the work that you guys do, because we always say this, nobody is going to help us but ourselves. Nobody's going to tell our story but ourselves. And so Audrey, Mele, Heidi, thank you so much for the work that you guys are doing there, because of the whole team and everyone. Like when the pandemic happened, like you said, no hesitation, we jumped in to help our whole community. And so it's amazing to, like, my mom didn't even know that PIs had a high number during the pandemic. And she's like, oh, I heard, we're not, none of my friends heard of it. And so I led her to, you guys' pages and with data that comes out every week. And she's like, oh my goodness, I didn't even know. And so, thank you, everyone that jumped right in to help. We had to help ourselves, right? So, and also congratulations on all the great work that you're doing.
I do want to also, I know that Heidi just touched on it, but really and truly, Epic really came through for us as a partner, and to be able to help us find funding to be able to even get started. That's how we started our original wellness phone banking project, and just continuously sending us grants that come available that we might be able to apply for. I mean, she does it with everybody else too, but it was those opportunities during this devastating time. I mean, COVID has been a blessing and a bane, because it brought us together. We have, as Heidi said, we're now going to be able to hire people to take on staffing that we've not ever had before. So, we got to kind of hit the ground running, learning how to do payroll and workman's comp insurance and all that stuff. I'm like, Lord have mercy. I am so glad that Heidi is an accountant, because that's just too much for me. But we're really, we're hitting the ground running. But it was with, with Tavai coming in with, funding opportunities for us, we're able to continue this work. And even too, as we're looking at this work, and because of all the work that's been done within this last year, to not have it stop when COVID's gone. So to be able to have that group that's already there set up for whenever the next thing comes along, we already have, we already know how to get it done. It's just like whatever the subject is, let's tailor it to that and move forward and implement all of those programs to help our community and our people. So yeah, thank you.
I think that's a really good point. I was reading about cancer research, and they were talking about how COVID-19, because it was such a unified effort between companies are actually sharing some information. It was a unified effort for funding from the government. And they were saying this could be a jumping off point in terms of research, because the infrastructure is somewhat being built. And now the patterns there, like people are expecting, like, why can we do this for COVID in 12 months, but we're not able to do it for other things? So there's things that in a global scale, the infrastructure is being built, and hopefully it will move it forward. But to your point, Audrey, there are things that we know we can do now that we don't need COVID. Once COVID goes away, we don't need another catastrophe or a pandemic or something to know that we have bandwidth to our people, that we can reach our people when we need to. And it can be about, health. It can be about, everyday standard of life and those kind of things. So to Naki's point, thank you so much for the work that you're doing, because it's not just today. These could have long-reaching, far-reaching effects for our people, because now we know how powerful we can be when we say, I mean, I was proud of the numbers, even though the numbers, I would see numbers that were high, right, for the PI community. I was proud that the numbers were there, right? I wasn't proud of the numbers because we're high, but I was proud of the numbers that I could see them. And so every time that we got the report and we had disaggregated data, it made me feel proud that you all had championed for it and were able to see and point to and educate and get funding and get help, because you were able to put us on that stage and be seen. So one of the things I wanted to bring up, and we're this hour is moving along quickly. I wanted to note that this is Women's History Awareness Month. March is Women's History Awareness Month, and it was actually started in California, in Sonoma County in 1978. So this is a movement that started in California, but it's going to be a while, but there's going to be a time when people like Mele and Audrey and Heidi and Tavai and Alisi are looked at, when Inaki and I were trying to look back in Pacific Islander history, going, who can we recognize? But you think about the people there, it's a women's show basically right now. Right now, it's powerful women on this show. And our people are going to be looking back at a certain point and looking at what was done during COVID-19. And they're going to talk about the women that are on the show and the women that are in other, other regional task forces and doing other things for our people. So I hope that you understand how big of a shadow you cast. And I know that we're a humble, our humility is big with the Pacific Islander community, but what you're doing is a lot bigger than just COVID. There's a lot of younger generation that's looking at the things that you ladies are doing, and we're proud of you. We're proud of you in terms of a community. I'm proud to just be on the show. So I was like, my point's going to be to shine the light on everybody on the show. But thank you, ladies, for everything that you're doing. And History Month, in a few years, people are going to be talking about the things that you're doing and your own names.
We sit on the shoulders of our ancestors all the time, and we don't take praise very well and things like that. I know I am a shining example of my, grandmothers, great grandmothers, and even the advocates that taught me, just to give, even with the dance group, my mother-in-law said, please don't charge the kids to learn their own culture. And, I'm looking at my mother-in-law and it's like, that Nana, that's not a good business plan, So, but it's examples like that. And, and Tijuana Sanchez out here in LA. And, I can just say names after name after name, and Auntie Mary Salas, but it's those names and those examples that I was taught very young, right out of college, like, here, this is yours, you got to do it. Like, there's no question, you're voluntold, right? You're voluntold to do these things. Even my parents are such strong, supporters, and my brother, they're constantly like, what do you need to do, what do you got to do, how can we help? So it's definitely going to change to, looking at this, it's her story, not history, Carl. So, but we're just here for today, and we do this for those that have yet to come, and that has always been taught to me by all the leaders, around me, and those that I follow, because they also casted a large, shadow and it's not that we want to do it for the glory. It is actually, like I said, it's for those who have yet to come. So thank you, Carl.
Thank you.
In such a time as this, I think that we all come together to help our community, educating them as far is that when the numbers were high last year, I was because when I was out there asking for food for my community, they were offering vegetables and fruits and all the healthy food. But I was like, where is the meat? We like to have the meat. But then again, at the same time, I am out there to let our people know, hey, we got to eat right. We got to take care of our health so those numbers can come down. And it was so important for me. And I was having fun with that, trying to educate our people. But at the same time, we got some meat from other areas as well as veggies and fruits. But yes, as like what I said earlier, in such a time as this, we come through with no hesitance to help our community, no matter what it is that they're needing out there. Thanks, Carl.
Thank you.
I think the pandemic, even when they say it's over, we still have people that are behind on their rent, that are going to need help, still back paying rent, still needing food to feed their families, and you'll still be there. I don't know if people know this, you'll still be there to get them resources, to get them vaccinated. I know that getting our elders vaccinated is the push right now. And in the beginning, when we first started talking about the vaccine, people were like, no, thank you. I'm going to grow an arm, extra arm or something like that. Do you think it's the work of you guys reaching out and talking and just continuing to show your face and talk about vaccine, or now, like you said, Audrey, people are starting to come around with the vaccine, wanting to get vaccine?
So I'm going to tell you the truth. I work on a medical facility. I work on Harbor UCLA Medical Center. It's a trauma 5 center. If you get shot, you want to go there because they got good doctors. But so I work for a clinical research organization, the Lundquist Institute, and they did the AstraZeneca COVID clinical trials there. And I was just absolutely against it. It was just too quick, not enough information. And then they irritated me because they weren't even going to do Pacific Islanders because they were saying that, you know, the consent form was far too difficult for translation. So then I got really offended because I'm like, oh, so you can translate into Spanish, but you can't translate into a Pacific Islander, you know, language. And we have all these Pacific Islanders that live in this area. And so I was just really, really irritated with them. And we went a couple of blows several times in meetings. But, you know, and he says, oh, well, I didn't know. And I said, well, you didn't ask. I said, we have Pacific Islander medical professionals working on this campus who would be willing to volunteer their time to go and translate the information for a Pacific Islander or even be there to vaccinate them or whatever. And I said, so the fact that you didn't even ask tells me right there that you were just, you know. So anyway, we've not kissed, but we've made up. And so after hearing all of the back and forth about the vaccine, listening to Dr. Koviki Liu talk about it and other researchers and that kind of stuff, and to know that, you know, yes, it was done quickly, but they had been throwing billions of dollars at it. All of these you know, pharmaceutical groups were working on it. And like Carl said, all of this information is coming in. And so once it came ready, I'm going to have to raise my hand and let you know that I've had both of my vaccination shots, and it was Pfizer. I got it through Kaiser because I have Kaiser for insurance. But yeah, and you know, after I sat and thought about it, I said, you know, I get vaccinated for flu every year. And what is that word that begins with a P? Sorry, senior moment, pneumonia. So I get back, you know, I get those shots every year because of my age, because of my comorbidity, all of that stuff. So, you know, what's another one? You know, and especially if there's like at least a 90%, you know, effectiveness with it, you know, that means I'm only 10% out there. And then if I do get it, maybe I'm not going to get it as bad. So I had to like do all of that stuff in my mind. But to be able to tell people that, yeah, I wasn't for it either, but this is where you know, this is how I went through my little thought process. So I think that makes a difference. And I think the majority of us, Heidi's been vaccinated, so to be able to tell them that we've done it and what we went through, I had pretty mild, my second shot was pretty mild, but it's not any more than a flu shot, you know, and you got to take care of yourself when you're doing all of this stuff. So yeah, I think it's having our faces out there, talking about it, and just keeping it personal too. I think keeping it personal makes a difference.
I think it was really a help for me to motivate my community to get the vaccine done, because I got mine, and also my mother and my daughter, who is a nurse up north. And for three of us, and I'm out there letting everyone know, hey, I got mine, my mother got hers, and they didn't feel, I explained how we all felt about the vaccine. On my second dose, I let everyone know that it was not as bad as the first one. The first one that I felt my arm was more sore than the second one. And when I got my second shot, the nurse was telling me to expect a lot of side effects is going to happen to me. So I waited for those. Um, Nothing happened. I did not have no headache um, or chill or fever, and I did not take no Tylenol. So I was able to explain that to everyone that I come across in my community, especially when I do the food distribution. I said, hey, I got my vaccine. If you get yours, you better go get it, because look at me, I'm doing well. So in order for us to let our community know that we got the vaccine, it is huge for them. And some of the elderlies that they went and got the vaccine last Wednesday, it really helped, because some of them called me and said, tell me what happened to your mother. Tell me, is that true? What happened to your daughter? And I explained to them, okay, then we're gonna go do it. So it's great.
And Naki talked about this earlier, was we want to know somebody, right? So like when the rates were high, the disaggregated data was telling us that it was high. And Naki and I were both getting questions like, well, do you know anybody that has it? Do you know anybody that's died from it? Early on, and it's really that in the community. I think it's the same way with the vaccine. Is the more people that everybody sees doing it, the more acceptable it's going to become. But yeah, that was a question that Naki and I got a lot early on. Was, well, I don't know anybody that has it or died from it, and it was it was alarming that the data was there, and some of our own community just wouldn't believe it until they knew somebody that that was affected by it, that either got sick or passed away. But I think Mele, you're right. Is the more of our community that sees us, the more people we talk to, the more normal it becomes.
Yeah, in the Chamorro community, we had last month, we had just in Orange County, we had 2 deaths. In San Diego, we had, I think, 2 to 3 just in February. And so now, you know, folks are asking, can you get me in? I'm hearing that you can get me in. And it's like, yeah, I can. But Auntie, there's, certain protocols and things like that that we have to follow based on what the state, is predict, what they're telling, can the next phase and things like that. But what I think is important too is back home in the territories, Guam is already at, the 55 years and older, and they're practically, done with vaccinations, as well as Samoa. In Saipan and in Tinian, they have 0 cases. In the Marshall Islands, 0 cases, and they're getting vaccinated. So I think it's important if our family back home, talks to the family that's here. And lets them know, I didn't have any, side effects, or I had side effects, or they were minor, but I'm still here. And that's what amazes us, is like when an elder says, I'm scared, Heidi, I don't want to do it. I'm not comfortable. I'm scared. I'm diabetic. I'm this, I'm that. I'm like, but didn't you have the polio vaccine when you were younger? Didn't you have this other type of, are you okay, Auntie? And they're like, yeah. And it's like, Well, I think you're fine, and I'm glad that I can say that I had been vaccinated as well as my parents who are, in their 70s, that, they can I can attest to them that they're fine. They didn't have any real side effects either. So it is important too that our family back in the islands, can talk to our folks back here, in SoCal and let them know, that what they went through. Because so it's word of mouth is really important too.
That's a really good point. Like MMR, if you grew up in the United States, measles, mumps, rubella, like almost all of us got that when we were kids. And if we're still here to talk about it, then it must have been okay. That's a great point. I didn't even think about bringing that up. I'm going to remember that and use it. Naki.
Great. Is there any info that you want to get out there to make sure that there's a message that we didn't miss? And I'll ask all three of you. We can start with Mele. You're on mute.
We just keep on doing what we're doing right now. It's making sure that the people out there are getting the information and more that come on the way, and not to be afraid of what's going on, but be there, be here with all of us together, because we are here together. We're going to face it together, whatever the problem is, including not paying the rent. There are resources out there that they can help those folks as well. And if they see stuff coming out, hey, share it. We all come together. Like this Saturday, Audrey, we're coming together. Heidi, you're welcome to come to my church this Saturday that we're doing this testing, and we're going to have a feast. So all of you guys are welcome from Northwest. Yes.
Thank you, Mele.
So I agree with everything Mele Faiva has said. Just let people know that we're here, that we're doing the best we can. When things change, we're going to let you know, because we don't want you to be mad at us. It irritates us too. So all of those things that Mele has said, and allow me to do a pitch right here for the community engagement research program that Colin and I work on. In April on the 22nd and 23rd, we're going to have a COVID Coming Out Victorious in Spite of Disparities. And it's going to be a 2-day program, and we're going to have community as well as academia and Pacific Islander speakers, Asian American speakers, just to be able to hear what their stories are. We have young people speaking as well as more mature people so that we can get their perspectives, because we don't know what they're thinking if we don't talk to them and we don't hear what they're saying. And academia needs to hear this, because they got all that stuff going on in their head, but they need to come down here out of the clouds and talk to people that all their work is affecting. And we tell them that all the time. Unless they're gonna engage the community, then they can work all that stuff. But once they come to us, we're yeah, that don't work. That's not gonna work in my community. You gotta adjust that. And they're looking at Colin and I like, oh my God. But thank you for allowing me to do that plug.
And if you have a flyer, can you send it to us, and we'll share it also? Thank you. Heidi?
Yeah, I just want to plug our website, our social media, Pacific Islander Health .org. Take a look. We broke it out by region. We broke it out by county. Our talk story series are all on there for each of our, sub communities. And we're going to have another one actually on Wednesday. So it's kind of in regards to, Asian, anti-Asian racism during this, pandemic, and how it's affected Pacific Islanders. So please, we will definitely send out that info to you folks. But yeah, it's just, we, like Auntie Melly, Fiva said, and Auntie Audrey, we're here. We'll still be here. We're duplicating ourselves. We have a young Pacific Islander, group that is helping us, do the more technical stuff, and even just, pilot alumni from Epic that are now, graduated, have their master's degrees, or are working on their master's degrees, and have come to us to say, we're going to help. This is what we need. Can you help us? And, now they're working, some of them are working, and they're part of our group as partners in what we need to do and get done. So it's just really everyone coming together and continuing the work and knowing that we are here and that, like Auntie Melly Fiva said, if you need something, let us know. Hit us up on the website, hit us up on Instagram. We will get it done. We'll figure it out. We're in this together. We're all in this together, and we are going to figure out a way like we always do. So you can't hold us down. You cannot hold us down.
Thank you, Heidi.
100% that is true. We just want to, I know the time is up and gone, an hour is gone quickly, but we just want to thank you, beautiful ladies, especially this month where we're celebrating women, and we celebrate you three. We appreciate the work that you guys are doing in Southern California. Please go follow the page, look up the information. And like Heidi said, if you have a question and we don't know the answer, they don't know the answer, they will try to find it out or get you, to where you need to go. So thank you so much. Carl, do you have anything?
No, I'm just thank you to the ladies for your time and sharing the wisdom and all the work you're doing down there in LA. And I'm Naki, and I always say this: how do we end up rubbing shoulders with
Right.
people like you? And every week we get a new group of amazing people. So no different. You're amazing, and everything you do, we appreciate. Thank you.
Thank you so much.
Thank you all. Yes, let us know if you are in LA or Orange County and you need a vaccine. You're 65 and older, you're a healthcare worker, you're a food service handler. Let us know. We have slots, we have appointments, availability. Please let us know.
Awesome. Thank you.
Thank you so much.
Thank you so much. Thank you.
Have a great evening.
You too.
And